HIV is not oncogenic but associated with following malignancy: carcinoma cervix by HPV, anogenital malignancy by HPV, Burkitt's lymphoma by Epstein-Barr virus, oral hairy leukoplakia by Epstein-Barr virus, Kaposi sarcoma by HHV08, Hodgkin's lymphoma, and NHL 80%. Live vaccines are BCG vaccine, measles vaccine, oral polio vaccine, cholera vaccine, false cancer hepatitis vaccine. Contagious diseases include tuberculosis, leprosy, scabies, trachoma. Contagious diseases include true answers: leprosy, scabies, trachoma. False answers: malaria, tuberculosis. Contraindication of live vaccines are leukemia, corticosteroid therapy, pregnancy. False answer: administration of another vaccine, autism. Advantages of DOTS for TB are low cost, lower failure rate, reduce drug resistance TB bacilli, decrease morbidity. False answers: rapid bacterial conversion. Diseases prevented by pentavalent vaccine are pertussis, hepatitis B, Haemophilus influenza type B. False answer: poliomyelitis, measles. Tuberculosis is a communicable disease, bacterial disease. False answer: emerging disease, viral disease, subclinical disease. Bloodborne diseases are hepatitis D, malaria, syphilis. False answers: ankylostomiasis, amoebiasis. Details transmitted through blood transfusion: malaria, trypanosoma cruzi, leishmania, Wuchereria bancrofti. The vaccine preventable diseases are hepatitis A, hepatitis B. False answers: hepatitis E, hepatitis D, hepatitis C. Vertically transmitted diseases are viral hepatitis B, human immunodeficiency virus infection. False answer: poliomyelitis, Escherichia coli diarrhea, cholera. Pentavalent vaccine is given for protection against following diseases: true answer: tetanus, diphtheria. False answer: poliomyelitis, measles, chickenpox. Features of oral polio vaccine include provide intestinal immunity, provide humoral immunity, contraindicated in pregnancy, live attenuated vaccine. False answer: not efficacious for polio epidemics. Disease transmitted by droplet nuclei are Q fever, influenza, chicken pox, false answer anthrax, tetanus. Subclinical infection occurs in true answer mumps, rubella, measles, diphtheria. False answer herpes simplex. Subclinical infection occurs in mumps, rubella, measles, diphtheria. False answer herpes simplex. Incubation period of rabies depends on species of biting animal, mode of transmission, severity of bite, site of bite, host immunity. The following are the viral diseases: mumps, measles, herpes simplex. False answer tetanus, diphtheria. Following diseases are not caused by virus: rheumatic fever, enteric fever. False answer poliomyelitis, smallpox, common cold. Pentavalent vaccines prevent the following diseases. Answer tetanus, diphtheria. False answer tuberculosis, poliomyelitis, hepatitis A virus infection. Anthrax is regarded as a true answer exotic disease, epizootic disease, enzootic disease. Wool sorters disease. False answer holoendemic disease. Indications for anti-rabies treatment are unprovoked bites. The biting animal can be traced or identified. Fluorescent rabies antibody test of the brain of the biting animals are positive for rabies. False answer if the animal does not show any signs of rabies within 10 days of observation. Nobody bites by wild animal. AIDS is due to true answer reduction number of helper T cell, reduction of CD4 cell. False answer reduction in number of killer T cell, autoimmunity, non-production of interferon. AIDS is due to true answer reduction number of helper T cell, reduction of CD4 cell. False answer reduction in number of killer T cell, autoimmunity, non-production of interferon. Human cell infected by HIV, CD4 helper T cell, helper T cell, monocyte, macrophage, B lymphocyte, astrocyte, oligodendrocyte. Zoonotic diseases include plague, rabies. False answer gonorrhea, typhoid, oriental sore. Live vaccine include BCG, measles vaccine, oral polio vaccine. False answer rabies vaccine, tetanus toxoid. The following diseases can be prevented by pentavalent vaccine. True answer pertussis, tetanus. False answer pneumonia, hepatitis E, anthrax. HIV or AIDS spreads through. True answer blood and blood products. Unsafe sex, injection. False answer classroom activities, overcrowding. Measles vaccine may be given at the age of 9 months. False answer 6 weeks, 3 months, 6 months, 12 months. Anthrax is regarded as a exotic disease, epizootic disease, enzootic disease, wool sorter's disease. False answer holoendemic disease. Prevalence of tuberculosis infection in a community is estimated by tuberculin test, chest x-ray, sputum microscopy, sputum culture. False answer urine culture. Toxin mediated food poisoning are due to true answer Staphylococcus aureus, Clostridium perfringens, Clostridium botulinum. False answer Salmonella spp, Campylobacter jejuni. The following are the diseases for which EPI vaccines are given. True answer tuberculosis, tetanus, hepatitis B. False answer typhoid fever, hepatitis A. Sexually transmitted diseases are answer syphilis, gonorrhea. False answer scabies, tuberculosis, yellow fever. Early detection of breast cancer can be done by mammography, thermography. False answer digital x-ray, FNAC, excision biopsy. Modifiable risk factors of non-communicable diseases include tobacco inhalation, physical inactivity, stress. False answer inheritance, ethnicity. Risk factor for heart-related illnesses are age greater than 65 years, obesity, heart and lung diseases. False answers low socioeconomic status, rural residing. Modifiable risk factors for coronary heart diseases are answer obesity, physical inactivity. False answer age, ethnicity, personality. Examples of non-communicable diseases are diabetes mellitus, malnutrition, coronary heart disease. False answer AIDS, measles. Characteristics of non-communicable diseases are long incubation period, multifactorial causation, irreversible pathological change. False answer definite onset, defined etiological agent. The following are the modifiable risk factor of coronary heart disease. Answers obesity, moderate alcohol intake, dyslipidemia. False answer genetic factor, older age, chronic non-communicable diseases. Answer do not have biological agent but have risk factors, are caused by non-reversible pathological alteration, have multifactorial causation and long latent period. False answer expected to require a short period of supervision, observation and care, may be cured completely with appropriate treatment and care. High risk population for diabetes mellitus. True answer persons having diabetes in their family, people who eat more but do not do physical work. False answer, people who are not fully vaccinated, people who do excessive physical work, people suffering from repeated infection. The following occupations have been associated with high risk of cancer: coal mine, nickel worker, asbestos worker, beryllium worker, tobacco industry. Major killer diseases are: answer, myocardial infarction, stroke, cancer. False answer, diabetes mellitus, panic attack. Non-communicable diseases are: answer, diabetes mellitus, malnutrition, schizophrenia. False answer, AIDS, sexually transmitted infection.